Medical service providers say they are seeing a steady increase in migrant workers using telemedicine services in the past 2 years. Some are seeing about 3,000 patients online every month. Doctors say such telehealth services ensure workers can seek timely medical attention. Steps are being put in place to ensure the system is accessible to more workers. Risha Matthew with more.
And select our telemedicine.
With just a few taps, migrant workers in any part of Singapore can reach a doctor, get a diagnosis and receive medication, all without travelling to the clinic. Fullerton Health has provided over 60,000 such online consultations using their telemedicine app since 2022.
Not only saves on time and costs associated with travelling to a clinic, but also improves productivity as workers do not need to take time off work. Consultations can also be done outside the usual clinic hours, which are crucial for workers on shift work schedules.
Telemedicine service is provided for under a basic care plan for migrant workers introduced in 2021. A year later, it became mandatory for employers to buy the plan for their workers. Under the program, 4 healthcare providers were identified as anchor operators, covering 6 sectors in Singapore. The aim was to ensure access to healthcare for the 442,000 migrant workers in Singapore. That's why providers have tried to make their services easy to use and remove language barriers.
Fullerton Health engages with employers to help to raise awareness by providing the migrant workers with user guides on how to register and utilize telemedicine services. These user guides come in English, Mandarin, Bengali, Tamil and Hindi.
But for some providers, different challenges await.
In the past, there was some reluctance to accept electronic medical certificates. I guess a key thing is good communication. When this happens, the employers, they may contact us for verification. And I think all it takes is for us to just communicate with them that, telemedicine is also proper clinical care.
Bring your knees close to your chest.
To allay concerns by employers that workers could take MCs too frequently, providers have adopted some measures.
A good principle from the doctor's point of view is to do a good history and examination. Often if we do see that the patients have been taking quite frequent MCs, the doctors may refer the patient to the clinic just for a more thorough examination and just to make sure there are no other underlying issues.
Both providers say they are still trying to reach out to more workers to use their telehealth apps. For some like Fullerton, that means widening the services to offer other forms of support, such as for mental health.
And joining us is our next guest, Dr. Kang Hock Siang, Deputy Lead of SATA ComHealth's Migrant Workers Clinic project. Dr. Kang also runs various SATA ComHealth clinics with a primary focus on migrant worker health. Dr. Kang, welcome to the studio.
Thank you for having me.
So we saw earlier in the report that more migrant workers are turning to telemedicine. It is a welcome development, isn't it?
Yes, very much so. Because migrant workers are staying in dormitories. Transport for them is often not very easy, and they often rely on company transport from their employers to even get out of the dormitories when they're not at work. So telemedicine provides them with an avenue for them to access healthcare when they feel they are not well enough to go to work, but not serious enough to actually see a healthcare provider to treat and give treatment.
Okay, so to ensure that the system is being used effectively, when should a migrant worker go to a physical clinic, and when should a migrant worker turn to telemedicine?
So SATA's telemedicine services, all our doctors and staff are trained to screen for patients who qualify for telemedical care, depending on the severity of their diseases. Symptoms such as a very mild headache without any what we call red flag signs, meaning that it could be a more serious underlying disorders, musculoskeletal pains due to overwork but not resulting in injuries. This can probably be handled over telemedicine, as medications can be sent over to their dormitories, and doctors can give advice over the telemedicine app. For more serious conditions, of course, even chronic diseases where they want to check their blood pressure, they would have to go to a clinic to get it done. Injuries, lacerations per se, definitely will have to be seen physically at the clinics.
So it really depends on the severity of their conditions.
Yes.
And as we know, migrant workers, they often face challenging living and working conditions. So what are some of the common health concerns or occupational health hazards that they experience?
Yes, so all the migrant workers that SATA's clinics, migrant worker centers cater for are those in the construction, marine shipyard, process sectors. So from these sectors, we know that they are constantly faced with manual material handling, vibration tools, they're exposed to the elements and heat. So these usually results in musculoskeletal conditions, carpal tunnel, tendonitis, injuries, and even skin conditions from exposure to like chemicals and irritants, basically due to the nature of their jobs. So how we can help at our clinics is advise and treat accordingly, as our doctors are all trained to identify and even report occupational diseases that are required by MOM.
And as our reporter Risha has discovered in her report, some providers she spoke to mentioned that some employers were concerned about many workers getting MCs. How big of an issue is this?
I think there's the concern is valid and it will always be there. How healthcare providers, how we as healthcare providers from SATA can reassure employers and also the migrant workers is all our doctors are trained to treat, diagnose appropriately. When workers come in frequently to get MCs or medical certificates, sometimes it might be an underlying undiagnosed condition or even a mental health condition.
Okay.
So our doctors will frequently screen. So if they do turn up, even for telemedicine services, if they do turn up too frequently, the telemedicine services will actually refer them to our physical clinics. And from our physical clinics, we can do the appropriate examinations, blood tests even.
And what can be done to reassure these concerned employers, Dr. Kang? What can be done to encourage them not to disregard the healthcare needs of these migrant workers?
I think a lot of it is education. So with us being now currently 2 years in running the medical centers for migrant workers and being established in the space, we are actually frequently in contact with employers, and we always invite employers to reach out if they do actually have concerns. So our medical center doctors are all trained and experienced doctors. So what I would say is, if your workers do present with any concerns about their health, let them be seen by a healthcare worker, and if need be, discuss with the worker and discuss with the healthcare providers on what can further be explored.
Very quickly, Dr. Kang, before we go, do you feel that the current level of healthcare available to these migrant workers is adequate, or do you think more can be done to help them?
I think Singapore is one of the first few countries that's provided medical care at this scale for migrant workers, and it has benefited them a lot. So ever since discovering that these migrant workers are underserved, when we went in to treat them for initially COVID-19 issues, we discovered they have many underlying medical conditions that needed treatment, and I think we've come a long way. Of course, we are constantly exploring whether services and treatments can be expanded to involve more coverage. For example, we've currently added physiotherapy to help with rehabilitation for injured workers.
All right, Dr. Kang, we appreciate your insights. Thank you very much for speaking with us tonight. That was Dr. Kang Hock Siang from the Migrant Workers Project at SATA ComHealth Migrant Workers Centre.